This is an archive of Beauty and Ugly Times, part 14, for Tuesday, March 31st, 2020. Let's be honest, guys, today was an ugly day. Our country is finally coming to terms with the reality and severity of what we face. I think that a decent chunk of the public is probably still living with a degree of collective denial because it doesn't feel real yet. But now, even the president, who has for the last 3 months minimized this issue, today he entirely inverted his script and acknowledged that we are looking at 6-figure death toll in this country. This is a reflection on on that very somber number. There is no easy, beautiful thing to point to tonight. It's hard to see, something beautiful in these circumstances. It's not impossible, though. It's just hard. And so, tonight, I'm walking up the street towards the Lennar Medical Center on the University of Miami Coral Gables campus to remember the many women and men who daily put their own health and safety on the line right now. Not because that's what they bargained for, but because that's what we need. And they are of such a moral character that they are answering the call. I'm going to stop here because if I go up the street, it's going to get noisy. There is the Lennar Medical Center. It's a beautiful place. It is the only medical facility that I've ever gone to where I feel comfortable on the inside. It smells good. It's like a spa almost. And it's staffed with maybe, I would estimate 100 to 200 healthcare professionals any given day. And that's one of our front lines. And I appreciate those people so very much. A small gesture of my appreciation is staying home as much as possible. And as to the extent I can, eliminating contact with other humans face to face. So I have just completed at 3 full weeks of isolation with only incidental contact with other people, like someone riding up on me quickly on a bicycle or someone standing near my door when I ordered a pizza instead of putting it down. I don't think I've had another person within 5 feet of me in that 3-week period. A couple people have gotten that close, and I've tried not to interact with them in any meaningful way, which sucks. If you know me, well, if you've known me in the last couple of years, you know I'm a hugger. I like to hug people, and I like to shake hands. I like to touch people, and to remind people in my interactions at any restaurant or Starbucks or school that I go to that they're human beings to me, not jobs, not employees. They're people. That sucks. It sucks to be physically cut off from other humans, especially since that's like the only real human contact I typically have. I don't have a lover. I don't have a partner. And let's be honest, I'm not going to have one anytime soon. But giving up my small pile of human touch so that doctors and nurses have as many available touches as possible to heal the sick and comfort the dying is what I can do and will do without any hesitation.